Welcome, everyone, and welcome to today's webinar, Supporting Equity and Caregiving in State Aging Plans. Before we get started, we'd like to review a few technical items to make sure that you can interact with us today. Next slide, please. Please click the Q&A button, and a window will appear where you may submit a question. We'll be taking questions at the end of today's webinar. We're also recording today's session. However, participants' lines are muted, so there's no need to worry about the recording capturing your interaction. We'll provide access to the recording on NASHP's website for you to view and share the recording as well as the slides after today's event. Next slide, please. Thank you for joining us today for this webinar. My name is Salom Teshale, and I'm a Senior Policy Associate here at NASHP. I want to first thank the John A. Hartford Foundation for their very generous support of and their guidance with our NASHP Family Caregiver Resource Center. I also want to thank Ronnie Snyder and Scott Bain, our project officers at the John A. Hartford Foundation. On our agenda for today's webinar, we'll first have a welcome from Marcus Escobedo at the John A. Hartford Foundation. Next, I'll highlight our NASHP Family Caregiver Resource Center and our new website with resource guides to support family caregivers. Then we'll hear from Emerson A., who will share findings and commonalities within the National Family Caregiver Strategy and federal initiatives on supporting Asian American, Native Hawaiian, and Pacific Islander communities. We'll next hear from two states, Ohio and California, on their activities in supporting family caregiver policy within state plans on aging. First, we'll hear from Ursula McElroy, the Director of the Ohio Department of Aging, on Ohio's work in family caregiving, equity, and aging. Then we'll hear about California's activities from Sarah Steenhausen and Dr. Nakia Thierry. Finally, we'll conclude with a Q&A and wrap up. Please also keep an eye out in the near future for the publication of the information within this webinar, including a publication of a crosswalk and the publication of an issue brief on these states' work in state plans on aging. It'll be coming out on nashp.org. With that, I'll pass it over to Marcus. Take it away. Thank you.
Thank you, Salom, and it's great to be here today. What a terrific lineup of speakers that we've got for the audience. So I am Marcus Escobedo, Vice President of Communications at the John A. Hartford Foundation. As was mentioned, we are a proud funder of NASHP and a sponsor of today's webinar. We are a national philanthropy based in New York City. Our mission is to improve the care of older adults, and one of our priority areas is family caregiving. We partner with NASHP and the Administration for Community Living in advancing the national strategy to support family caregivers, which must be implemented in an equitable way. This is why we're so glad to have today's webinar with today's fantastic presenters. Because of today's topic, I'll share one great resource you should know about. It comes from the Diverse Elders Coalition. We funded the Diverse Elders Coalition to conduct research and develop a training program for healthcare and social service organizations to better meet the needs of diverse caregivers from different racial and ethnic populations and the LGBTQ+ community. You can find training opportunities for your organization today at diverseelders.org/caregiving. You can find more about that program, our support of NASHP, resources for multi-sector plans on aging that you'll hear about today, and many more resources at johnahartford.org. Thank you again for your participation today and for helping to advance equitable state support for family caregivers. Salom, back to you.
Thank you so much, Marcus. Next, I'll share some information about the work that we're doing here at NASHP to support family caregiving policy. Next slide, please. To give a bit of background about our organization, NASHP's vision is to improve health and well-being of all people across every state. Our mission is to be of, by, and for all states by providing nonpartisan support for the development of policies that promote and sustain healthy people and communities, advance high quality and affordable health care, and address health equity. To accomplish our mission, we advance innovation by supporting states in developing new policies and programs, support the implementation and spread of best practices by engaging states to inform data-driven policymaking at the state and federal level, ensure states have information, data, and tools they need to successfully design and implement policy, elevate the state perspective for a wide range of groups, partners, and the public, and encourage sustainable cross-sector solutions by strengthening partnerships across state agencies, executive and legislative branches, and the private sector. Next slide, please. To share a little bit of background about our work in family caregiving, since 2019, we at NASHP have been developing a resource and dissemination center centered around the work of the RAISE Family Caregiving Advisory Council. This council was convened as part of the RAISE Act, which is a framework to support a national level strategy to support family caregivers. The RAISE Act also required the creation of a national strategy, which we'll hear more about later on from Emerson. Next, I'll share a little bit of information about our RAISE Dissemination Center. Next slide, please. To support the activities of the RAISE Council, NASHP established the RAISE Family Caregiver Resource and Dissemination Center, which is supported by the John A. Hartford Foundation. Our center contains information targeted to state policymakers about the activities of the RAISE Council and also has extensive resources, including blogs, briefs, and webinars to support states that are interested in developing family caregiver policy. We also regularly convene experts in our RAISE faculty. As I said before, please keep an eye out in the near future for the upcoming publications that we have around family caregiving, equity, and aging, along with the crosswalk that we'll hear a little bit about very soon. I also wanted to highlight our newest piece of content, which is supportcaregiving.org. Next slide, please. We've recently launched this website, which contains a number of action guides and resource guides for a wide range of individuals on supporting family caregivers. The resource and action guides can include information for employers, for people who work in managed care plans. It includes information on respite care, the direct care workforce, and state policy strategies for state officials, and also has an action guide / resource guide for family caregivers. Please do take a moment to check out supportcaregiving.org and read through the resource guides that we have available. Next slide, please. I'll now turn it over to Emerson.
Thank you so much, Salom. But thank you to NASHP for providing me a platform to present to you the results of a crosswalk analysis of 2 national strategies aimed at supporting AANHPI family caregivers. And the 2 national strategies that I mentioned include a 2022 national strategy to support family caregivers, and the other national strategy is the national strategy to advance equity, justice, and opportunities for the Asian American and Native Hawaiian and Pacific Islander communities, released by the White House. Next slide, please. This is a brief overview of how my presentation would unfold. I will provide a very brief overview of family caregiving in the AANHPI community. And then I will spend time on sharing with you the results of that crosswalk of the 2 national strategies that I alluded to. But more importantly, towards the end, I'd like to really discuss with you all the implications of that results, as well as the significance of those results of the crosswalk analysis in supporting family caregiving in the AANHPI community. And I will have a very brief summary and conclusions. Next slide, please. So the AANHPI population is very diverse, and it's a rapidly growing segment of the country's population. It encompasses a broad range of ethnicities with distinct cultural, linguistic, socioeconomic, educational, and historical backgrounds. Regarding the AANHPI 65 years and older population, it is projected that the current number, estimated at 2.5 million, will grow to 7.6 million by year 2050. And that will account for 8.6% of the country's total older adult population. This demographic change has many implications to our society for sure, but also has significant implications to family caregiving. So in the AANHPI community, family caregiving is largely influenced by cultural norms, traditions, social structures, which shapes the roles and expectations and experiences of the caregivers. So according to the National Asian Pacific Center on Aging, 42% of AAPIs provide care to an older adult, and that is compared to 22% of the general population. The AANHPI community also face distinct challenges in family caregiving, and these challenges are varied and multifaceted, but some of them I'll mention here. Language barrier is an important challenge in the AANHPI community. Immigration-related legal issues, lack of awareness of the resources related to family caregiving, and socioeconomic factors, limited access to healthcare and social services, among others. And these challenges have been magnified by the COVID-19 pandemic, where disparities in care, access, and health outcomes have become more pronounced in the AANHPI community. Next slide, please. So a little bit of a background about the 2022 National Strategy to support family caregivers. So the two national advisory councils created under the RAISE Act that Salom has alluded to earlier, and the Supporting Grandparents Raising Grandchildren Act work collaboratively to develop the 2022 National Strategy to support family caregivers. So the aim of the strategy, of the National Strategy for Caregiving, is to describe a comprehensive roadmap to recognize, assist, include, support, and engage family caregivers. It outlines 5 goals, 27 outcomes, but it includes a set of action that describes how federal agencies, states, communities, and other stakeholders can assist to advance family caregiving. This document also discusses 4 essential elements that must be at the core of developing, delivering, and evaluating family caregiver supports and services. And these include the need for person and family-centered approaches, trauma and its impact, prioritizing diversity, equity, inclusion, and accessibility, and the need for direct care workforce. Although there is recognition in the National Strategy to support family caregivers that family caregiver experiences and support vary considerably among types and needs of families and groups, there is a need to further explore deeper how different populations and cultural and ethnic groups experience family caregiving. And this is true for the AANHPI population. So the slide that you see in there is the White House National Strategy to Advance Equity for AANHPI communities. So as I previously alluded to, the COVID-19 has really impacted the AANHPI community. And in response to the pressing needs of the community, President Biden signed a presidential measure, including Executive Order 14031, that established the White House Initiative on Asian American, Native Hawaiian, and Pacific Islander. This White House initiative released the National Strategy to Advance Equity, Justice, and Opportunity for the AANHPI communities that was released in January of this year. So just very briefly, the White House initiative, the National Strategy from the White House, is guided by 14 principles and focused on 7 cross-cutting strategic priority areas of concern to the AANHPI community. And this include promoting belonging and inclusion and combating anti-Asian hate and discrimination, data disaggregation, language access, promoting equitable and inclusive COVID-19 response and recovery efforts, capacity building, federal workforce diversity, and outreach and engagement to AA and NHPI communities. The release of this White House initiative document and the 2022 National Strategy to Support Family Caregivers provided the opportunity to examine how their priorities and goals align, overlap, or relate in advancing family caregiving in the AANHPI community. And this crosswalk analysis was the focus of my work as a health and aging policy fellow, working under the Administration for Community Living and working very closely as well with NASHP. Next slide, please. A little bit more about the aims of the crosswalk analysis that I did as a primary deliverable for my health and aging policy fellow. The crosswalk aim was to identify areas of convergence and synergy that could facilitate better coordination, interagency collaboration, and allocation of resources that could support family caregivers, specifically the AANHPI family caregivers, and then gaining insight in that space in policy priorities and approaches that can assist in evaluating its impact and effectiveness. And finally, the crosswalk aim was to also provide a blueprint for addressing family caregiving needs and concerns of other populations. Next slide, please. So briefly about the methods of this crosswalk analysis, I use the equity lens framework as defined by Executive Order 13985, and I'll read it here on the screen. Equity is defined as the consistent and systematic, fair, just, and impartial treatment of all individuals, including individuals who belong to underserved communities that have been denied such treatments, just Black, Latino, and Indigenous and Native American persons, Asian Americans and Pacific Islanders and other persons of color, members of religious minorities, LGBTQ+ persons, persons with disabilities, persons who live in rural areas, and persons otherwise adversely affected by persistent poverty and inequality. In addition to this framework that I use for the crosswalk analysis, I was also guided by this question: how might the National Family Caregiving Strategy support family caregiving in the AANHPI community? The analysis involved reviewing those foundational principles that I mentioned at the very beginning, the goals of each of these two national strategies and their priorities to determine how they're aligned and or related. Next slide, please. So that's a busy slide, but with regard to the results, as you can see there was a direct relationship between the third cross-cutting principle of the national strategy to support family caregivers focused on advancing equity, accessibility, and inclusion for family caregivers in underserved communities. And that's on the right side of your screen, with all the 14 foundational principles of the White House initiative on the left side of your screen. Next slide, please. Similarly, there's also convergence on the priorities and goals of the two national strategies, including their outcomes of the strategy. So on the right side of your screen, those are the national strategy goals to support family caregivers. And on the left, those are the priorities of the White House initiative to advance equity, justice, opportunity for AANHPI communities. So the findings of this crosswalk analysis really show that the aims and the foci of the national strategy to support family caregivers align with the priorities that are important to the AANHPI communities to advance equity, justice, and opportunities. And most importantly, the findings also validate the importance of understanding and addressing the systemic barriers that influence equity, social justice, and opportunities to better support AANHPI family caregivers. Next slide, please. So this is a more detailed picture of the crosswalk at the granular level. Here is an example of the relationship between a specific priority of the White House initiative on the left side of the screen, and priority 3 is about language access for the AANHPI community, with some of the specific goals of the national strategy to support family caregivers and their associated outcomes. So for example, goal 1, raising awareness and outreach. Goal 2 talks about advancing partnerships and engagement. Goal 3, strengthening services and support. And goal 5, importance of data research and evidence-based practice. So to provide you a more detailed example of this relationship, I'd like to go to the next slide to show you how that priority is related to goal 1 in particular. So this is an example of that, how that priority 3 is related to goal 1 of the family caregiving strategy. So the question that also I asked at the very beginning is, how might language access, including addressing cultural and linguistic barriers in the AANHPI communities, lead to achieving goal 1 of the national strategy to support family caregivers, which is to achieve greater awareness and outreach to family caregivers? But before we ask this question, a little bit of a background to share with you that there are many languages spoken in the AANHPI communities, and a third of AANHPI individuals have limited English proficiency. And this proportion is even higher among specific subsets of the population, such as recent immigrants and refugees. So to answer the question, how might language access, including addressing cultural and linguistic barriers in the AANHPI communities, lead to achieving greater awareness of and outreach to family caregivers? I included in there an example, and one example is to how could federal agencies, states, and community organizations, what they need to consider when planning for outreach to the AANHPI community. So as I mentioned in the slide, including materials that are multilingual, and that the outreach strategies factor in the cultural values and the various types of family caregiving in the AANHPI population. An example that I could think of that needs to be considered is the intergenerational family structure common in the AANHPI communities. So this is just one example of how the results of this crosswalk could be used to advance family caregiving in the AANHPI communities. And as Salom alluded to at the very beginning, when we started, there is a publication that gives you more examples and more detail of how the results of this crosswalk analysis could support family caregiving in the AANHPI population. Next slide, please. So in summary, the crosswalk of the national strategy to support family caregivers and the White House initiative reveals a significant alignment and shared priorities in promoting family caregiving within the AANHPI community. Also, the two strategies really highlight the importance of equity, accessibility, and inclusion as core principles in their documents and their respective calls to action. And there is a quote in there from the White House initiative that emphasizes that. So as I said at the very beginning, the initial work could also be used as a blueprint for understanding and addressing family caregiving experiences and challenges in the other populations. That has a lot of ramifications at the federal, at the state, at the local, as well as the community, at the community level. Next slide, please. So a very brief thank you to those who supported me in my fellowship and in conducting this work. First, to ACL, and also Greg Link, who is the Director for Supportive and Caregiving Services, for his mentorship, as well as NASHP, Wendy and Salom as well, and the funders of my Health and Aging Policy Fellowship, the Johnny A. Hartford Foundation, West Health and the Atlantic Philanthropies, and the National Program Office of the Health and Aging Policy Fellowship Program. Thank you.
Thank you so much, Emerson. Next slide, please. Next, I'll hand it over to Ursel to share information from Ohio.
Thank you so much. Thank you to NASHP, the John A. Hartford Foundation, my co-panelists, and everyone for participating in this really important topic. As director of the Ohio Department of Aging, I have the opportunity to oversee a cabinet-level agency within Ohio. It's executive branch, and that gives me the opportunity to serve as the principal advisor and advocate for 2.8 million older adults and their families. That allows us to work to make Ohio the best place to age in the nation. Yet we know to make Ohio the best place to age in the nation, Ohioans must live longer, healthier lives with dignity and autonomy, and disparities and inequities must be eliminated. Next slide, please. So to keep pace with the changing demographics worldwide and within the United States and our great state of Ohio, we know that it is essential to good stewardship of our country's public health system. We are aging faster than ever before. Between 2010 and 2020, the population aged 65 years and older saw the largest and fastest growth in any decade since 1880. Today, about 1 in 6 people in the United States are aged 65 and older. And if you rewind just 100 years, in 1920, this proportion was less than 1 in 20. So for the first time in our history, demographers do predict that we are on track to have more older Americans than children in our country. Next slide, please. So here in Ohio, we have the nation's 6th largest population of those 65 and older. And over the 15-year period from 2015 to 2030, this population is expected to increase by almost 30%. And we attribute this to many things: aging baby boomers, incredible advances in medicine and public health, and improvements in social determinants of health, such as what we eat, where we live, how we're educated, and our access to healthcare as examples. All of these things have contributed to these gains in life expectancy. Understand longevity is something we are all chasing. However, despite the great strides that we have made, allowing some of us to live longer than ever before, the privilege of longevity is still lagging for some. While overall life expectancy has increased, notable disparities exist. Moreover, an increased number of adults are living with chronic conditions that may not affect their length of life, but will dramatically impact their quality of life. Next slide, please. Within the Ohio Department of Aging, we recently completed a summary assessment of older Ohioans, and it's a report that provides a comprehensive picture of health and well-being of older Ohioans across the entire state. According to this report, there is still a gap of more than 29 years in life expectancy, depending on the zip code of where a person lives. So think about how long 29 years is. Think about where you were 29 years ago in 1994. People in low life expectancy areas are missing out on nearly 3 decades of life experiences. That's nearly 3 decades worth of holiday meals, catching up with loved ones, cheering your favorite team on, passing stories and wisdom on to others. This gap is too far and too wide for us to claim victory within the aging network and as a public health system. Next slide, please. So to further understand some of the complexities and what we have in our state, I've shown you an image that just depicts where we are just within Ohio. You can see that we have 2 different areas showing 4 communities. In one area, we have individuals living just 4 miles apart that have 21.9-year difference in their life expectancy. Likewise, we have 2 other communities that are just 18.5 are 20 miles apart, but have an 18.5-year gap. Next slide, please. So why do we see these things, and how can we address some of the complexities of aging? I want to spend a moment talking about this. It's important to understand these concepts of cumulative advantage and disadvantages, essentially the obstacles that are facing each of us. Some obstacles that are facing some individuals are far different than the obstacles others have to face and overcome. So for example, if you look at the image on the screen, you can see that these two people have something in common. They are both trying to get to the same finish line. But for today, let's imagine that finish line as a happy and healthy retirement with all the help and resources needed to live comfortably. Now, what are their differences? If you look at the woman on the right, her pathway is filled with many obstacles. Alone, each obstacle has the potential to impede her, and combined, these obstacles create a greater delay in her time to finish the race. She has a cumulative disadvantage. Now, conversely, if we look at the gentleman on the left, you can see that he has visibility to the end of the race. His chances to run around the obstacles and gain speed and momentum as the race goes on are considerable. He has cumulative advantage. The effects of risk factors, things we are exposed to and experience as children and across the lifespan, accumulate and shape trajectories in the short-term outcomes and in our long-term outcomes. And understanding these linkages and the many factors that contribute to one's health is imperative to attaining the wellness and longevity that many of us so desperately desire. Next slide, please. So navigating the complexities of aging is personal. Your experience and my experience simply won't be the same. Yet there are conditions or social determinants of health that impact us all. According to Healthy People 2030, social determinants of health are the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. At the Department of Aging, we believe the inclusion of aging in the definition of social determinants of health is critical. We respect the aging process as an individualized journey. We believe that health disparities are preventable, and we understand the data that the differences in the burden of disease, injury, violence, or opportunities to achieve optimal health are disproportionately experienced by socially disadvantaged groups and communities. Next slide, please. So as we look here at the social determinants of health, what becomes important in my work are thinking about what are the determinants of successful aging and longevity? What is the right combination of genetics, environment, and lifestyle to not only extend one's lifespan, but to expand one's healthy lifespan? What is the impact of health behaviors on the variation in how old we live to be? If we believe, and the evidence supports this belief, healthy aging begins early in life, then we must also believe that health disparities experienced early in life are often made worse later in life. And so we think about this from a public health approach, one that prioritizes aging, health, and equity will positively impact all of society and individuals of all ages. Next slide, please. So together with the public health system and the aging network, we can support a system that prioritizes the health and well-being of older adults and broadens our focus on prevention, wellness, and health, rather than only disease. Establishing our North Star to address equity across Ohio, we've done this through our State Health Improvement Plan, our COVID-19 efforts, and our executive response. All of these were really important steps. Targeting our approach, however, to more specifically support healthy aging and longevity required us to develop a strategic blueprint. Next slide, please. The strategic blueprint helps us to understand who we are, what do we prioritize, What are our strategies? We enlisted support from the Health Policy Institute of Ohio. It's a nonpartisan health policy organization to conduct and publish the summary assessment of older Ohioans in 2020. We did this through a multi-phase needs assessment process. We included online surveys, we hosted public hearings, and then we used a document to inform the development of a prioritized and specific action plan for our partners. Next slide, please. So, our state plan on aging is a multi-sector plan that calls on all Ohioans, including state and local partners in both the public and private sectors, to join forces to help Ohioans live longer, healthier lives with dignity and autonomy, eliminating disparities and inequities in aging. The plan serves as our comprehensive roadmap. It guides the state's aging network on strategies to advance elder justice and equity, and how we can achieve optimal health and well-being. It is utilized for planning, coordinating, and implementing activities the state will undertake to address the needs of older adults and to build the capacity of the long-term care system. This plan is derived from multiple inputs and milestones. Next slide, please. So, our priorities. When you look at our state plan priorities, we've identified 6. They were laid out as short, intermediate, and long-term targets that we can all work toward to help us eliminate these disparities. We focus on community conditions, social connectedness, healthy living, population health, access to care, preserving independence. Next slide, please. Throughout the plan, priority populations were identified, and this was really important so that we could be targeted in our efforts. Priority populations are a group of Ohioans with the greatest economic or social needs and who are most at risk of having poor outcomes. Many of the priority populations were identified based on available data and feedback from expert stakeholders. Next slide, please. So we're at a critical point in time. We realize this. The aging network is recovering from COVID-19. Our workforce infrastructure is struggling. That is an infrastructure that is supported by direct care workers and family caregivers and volunteers. It is at risk of burnout at a time when the demand for this support is growing. Meanwhile, the complexity of care needs and associated costs are rising, and the consumer demand for services delivered in a multitude of settings continues to increase. And we understand this is why it is so important to collect the right data. And when properly contextualized, it can help us tell a story of lived experiences and outcomes. The data can provide the accountability and a basis for trust in our work. When decisions are made by policymakers, funding, or otherwise, it is important for us to be equipped with the moral case for equity, but also the compelling facts for the impact that it has on our greater society. The data can help inform policymakers where changes are needed, where resources could be targeted, and to assure them on the return on investment that can be anticipated. Next slide. So in terms of our evidence of impact, we have to be able to demonstrate that what we're doing will be effective. And you will see throughout our plan that we have built in those important metrics so that we can show that what we're doing will have a real impact. This is based on many strategies, next slide, that you will see. In addition to the many strategies that we also have detailed tables. Our detailed tables are full of strategies and objectives to assure the quality of the strategies of the plan through a comprehensive evaluation of activities and quality management practices. These activities help us track progress on the state plan outcomes, implementation, and it helps us to collect information throughout the state. Next slide. You will find throughout that we have tables on strategies. Next slide. Our strategy tables collect information on our evidence registry, our systematic review, and it has a database of evidence-informed strategies. Next slide. And we also have objective tables. Our objective tables allow us to collect and demonstrate our clear objectives. We utilize SMART goals, and we have short, intermediate, and long-term targets that are focused on priority populations. Next slide, please. We believe that our tables and our data will ultimately result in Ohioans living longer, healthier lives. And we can build a future where better outcomes are attainable, not just for a fortunate few of us, but for all of us. These are the outcomes that we are striving for, where people can expect to age well on their own terms in their own environments. And this translates our plan into an impactful reality for individuals, communities, and our economy. So finally, we have a call to action for everyone who's interested in being a part of our plan. Next slide. It is comprehensive, but to reach our North Star, we know that we have to align, we have to advocate, fund, implement, partner, and evaluate our work. Ultimately, our vision is that we have both an aging network and a public health system in Ohio that not only continues to add years to life, but adds life to our years. Thank you.
Thank you so much, Ursula. Next slide, please. I'll now hand it over to Sarah to share information from California.
Great. Thank you so much, Salom, and thank you, Ursula. Thank you for that wonderful overview of the work that you're leading at Ohio. I am so pleased to be joined by Dr. Nikita Thierry, who is our Older Adult Program Branch Chief here at the Department of Aging, and is leading all of our caregiving work. So I'm going to talk a little bit about how our master plan for aging provides an opportunity to advance our work to embed equity within caregiving services to support California's caregivers of our old aging population. Next slide, please. So I'm going to talk to you a bit about the evolution of our master plan for aging and its broad approach to system change, and then highlight a little bit of our work in the caregiving space with a focus on equity. And then Dr. Thierry will follow up with some more details about how we are advancing this work at the program level. Next slide, please. In 2021, the state released its first master plan for aging. And why this was significant for California is this represented a whole of government approach and a very comprehensive framework for preparing the state for the year 2030, when 1 out of 4 individuals will be aged over 60. It's particularly important that we were able to pull in leaders from across agencies. So we have the governor's office convenes a cabinet level work group, including representatives from not only the Health and Human Services Agency, but from Housing and Transportation and Veterans Affairs and others, to ensure that we're really getting the voice of the whole of government as we develop these bold goals. When the plan was released in January of 2021, it identified these 5 bold goals that we believe really frame our work moving forward. The first is ensuring that all older adults, people with disabilities, and caregivers have housing at all ages and stages. And that includes age-friendly communities and transportation, walkable communities, a range of services that are needed to help people stay in their home. The second goal is focusing on reimagining how we deliver our healthcare services so that they're much more integrated and coordinated across the continuum, recognizing that people don't live in silos and that they need services across the continuum of care, including social determinants of health. The third goal really focuses on embedding inclusion and equity throughout all 5 goals. So we have targeted initiatives focused on inclusion and equity, but we really are ultimately achieving a framework where we can ensure that equity is embedded throughout all of the initiatives across the 5 goals. The fourth goal is looking at our caregiving workforce. So this includes both our paid direct care workers as well as the unpaid family caregivers. And in California, we have almost 6.5 million unpaid family caregivers. What we're going to be talking about today is our efforts to really hone in on our caregiving efforts and ensure that we're including an equity frame throughout so that we're targeting our resources appropriately and expanding access to those most in need. And then finally, our master plan includes the goal of affordability and how can we ensure that as people age, they don't impoverish themselves trying to address their needs. Next slide, please. What's really important about the master plan is that it's a living document. So here you can see the cover of our second iteration of the master plan in January of 2023 that we released earlier this year. We updated the plan based on all the work of our 6 stakeholder advisory committees that provided a number of recommendations and really grounded our thinking in how to continue advancing and updating the master plan for aging. So we have a framework for our new 23-24 initiatives focused on delivering results with an emphasis on increasing the number of people reached. The second is developing our data, our policies, and programs to drive a system change through system analysis and information. And then the third approach is through communication and education and outreach to ensure that the public is informed and that people have the ability to access the information they need to make informed decisions. Next slide, please. So it was excellent timing at the federal level when the Biden administration showed such tremendous leadership in releasing the 2022 National Strategy to support family caregivers. And we were able to leverage this work at the federal level and really think about how California might build out its own strategy, equity roadmap to support family caregivers. Next slide, please. So this is what led to the 4 key initiatives in the caregiver space in the master plan for aging. So these range from everything from Initiative 79, ensuring that all caregivers who receive services in our programs are assessed and that we focused on equity metrics. This is something I know Ursula spoke a lot to, that if you don't have the data to identify the problem, you can't serve the people who are most in need. So we're really working with our partners at the local level to ensure that our caregiver assessments track equity metrics and focus on reaching Black, Latino, Indigenous, and our API and LGBTQ caregiver population. Initiative 80 is building off of our workforce initiative, where we are developing a compendium of resources that we're currently using to train unpaid family caregivers across the state. And we will be essentially developing this resource compendium that caregivers can use in perpetuity once our initiative is concluded. The third initiative, number 81, is really focused on data and identifying unmet needs for caregivers across a range of different data sets. We too believe that if we don't really understand the unmet needs of our caregivers across the state, we're not going to be able to develop the programs and the pathway forward to meet those needs. And then finally, Initiative 82 is where we have housed our caregiver equity roadmap and strategy. So with all of this work and together with our partners at our Caregiver Resource Center partners, we're going to be developing a statewide caregiver equity roadmap that we hope positions California as a lead state partner in the Federal Administration for Community Living's national strategy to support family caregivers, including strategies to address the financial burdens of caregiving and the risk to financial security. Next slide, please. As I noted, we all agree that data is a key component to ensuring accountability and ensuring an equitable approach. So we're doing a lot of work to build off of our data dashboard for aging. And essentially, this is a dashboard that enables us to track our progress in advancing the master plan for aging across the 5 bold goals. Some areas have more data sources than others, but we are also working on a framework to assess the outcomes and the impact of the master plan for aging at a population level. So identifying key outcome metrics across the 5 bold goals that we can use to understand where we're succeeding and where we might be falling short. Next slide, please. We also have a tracker that's online where we can look up every one of our 91 initiatives and get an update on their status across departments and across the state agencies that are leading them. Next slide, please. We're really pleased with the results of the Master Plan for Aging. Since its inception, across all 5 bold goals, we have gathered the information and been able to compile all of the different resources together, and it comes out to approximately $9.5 billion in investments across the 5 bold goals that improve the lives of older adults, people with disabilities, and family caregivers. So we're really excited to be continuing to work these initiatives now and into the future, and look forward to hearing from my colleague, Dr. Nakia Thierry, who's going to speak more to our caregiver initiatives. Next slide, please. So I'll turn it over to you, Nakia.
Thank you, Sarah, and good afternoon, everyone. Thank you to all of my fellow presenters who have provided great information and resources to everyone on the call today. The overarching theme, as we all have heard, is that older adults are living longer. And what we do know is that with longevity comes the need for continued as well as increased services and supports. And so I'm very happy to hear that this is something that everyone is thinking about, all of my fellow presenters, as we continue to move forward with providing the supports that older adults and persons with disabilities as well need as we continue to age and within our growing communities. Today, I will be discussing, as a part of my presentation, 3 programs that we here at the California Department of Aging support as it pertains to caregivers and for care receivers. The first program that I will be discussing is the federal Title III Family Caregiver Support Program, which is administered under the Administration for Community Living. I will also be discussing our state of California Caregiver Resource Center network and providing very detailed information about that program and the network of centers that support not only family caregivers, but also care receivers. And then I will be providing a high-level update about an initiative that California Department of Aging has with the University of California, Davis, as it pertains to work centered on equity and inclusivity in caregiver services. Sarah did briefly mention that with our California Equity Roadmap. And then towards the very end of the presentation, I will give a high-level overview of our CASEO survey, which is the Community Assessment Survey for older adults that we have most recently completed as of September 4th. Next slide, please. So our Title III Family Caregiver Support Program. The Family Caregiver Support Programs are administered by California's 33 area agencies on aging and are supported by the Federal Older Americans Act program under the Administration for Community Living. The available Family Caregiver Support Services program includes services that are inclusive of, but not limited to, support services, respite care, access assistance, supplemental services, and information services, just to name a few. Next slide, please. Eligibility for the Family Caregiver Support Program includes family caregivers who serve both informally and are unpaid family caregivers of older adults and individuals of any age affected by Alzheimer's disease or a related disorder with neurological and organic brain dysfunction. Additionally, eligibility includes older relative caregivers age 55 plus who are primarily caring for a child or individual with a disability are also eligible for services. Per the OAA regulation, eligible FCSP caregivers will not be denied services for their inability to contribute to the cost of services. The best way that we tell all of our community members to get connected with the Family Caregiver Support Program is to reach out to your local area agency on aging. We do have a statewide California Aging and Adult Information Line, and that phone number is listed. It is 1-800-510-2020. That statewide number will link individuals to their local area agency on aging where they can get connected and receive services. Next slide, please. Next, I'm going to be talking about our California Caregiver Resource Centers. The CRCs, as we call them, are a network of 11 centers throughout California who serve family caregivers. The CRCs serve family caregivers who are providing support for someone who is affected or impacted by chronic and debilitating health conditions, including but not limited to dementia, degenerative diseases, traumatic brain injury, among many others. Some of the core programs under the CRC network include specialized information, uniform caregiver assessment, family consultation and care navigation, respite care, short-term counseling, support groups, education and caregiver training, and legal and financial consultation. Next slide. With our CRC network, eligibility includes caregivers who are caring for an adult with a cognitive impairment condition that occurred after the age of 18, or an individual age 60 plus in need of assistance with daily living activities. The CCRCs offer free support throughout the state, serving thousands of families and caregivers across income categories. The first link that is listed there is the CRC's website, and it is a great resource to get connected with caregiver support. And the second link within the slide takes you to the CRC website, where you will find virtual education events hosted by local CRCs. All events are open to the public. Other additional resources includes the CRC Evaluation Annual Report 2022, which discusses the evaluation of the California Caregiver Resource Center service delivery and system change. Next slide, please. I am now going to be discussing some efforts that we recently started as of July 1st, 2023, with our collaboration with the University of California, Davis. On July 1st, 2023, CDA launched a technical assistance project that is aimed at supporting Goal 4 of the California Master Plan for Aging, which my colleague Sarah did touch on, and that is caregiving that works, focusing on improving equity and quality of services and supports for family caregivers. The UC Davis Family Caregiving Institute is leading this effort and the accomplishment of the 4 goals in collaboration with the state of California, as well as our California Caregiver Resource Centers and other providers and stakeholders in the state of California. This project aims to develop an equity plan for caregiving services and supports, extend the existing CCRC evaluation to examine opportunities more closely for service improvements and outreach within an equity lens, identify and deploy evidence information interventions to address key caregiver concerns, and of course, map state of California efforts to the 2022 National Strategy to support caregivers, which follows in line with our roadmap for caregiving services and equity. Next slide, please. There are 4 aims for improving caregiver services and supports in California through equity planning. For timing purposes, I will just mention those aims. The first aim is collaborate with CDA and CCRCs to develop an equity roadmap for caregiving services and supports. Aim 2 is leveraging existing data in the CareNav system, which is a simple, user-friendly online system that is designed to help families navigate the complexities of the caregiving journey. Aim 3 is to identify, staff, and facilitate time-limited and ad hoc work groups of CCRC representatives and other stakeholders with specific goals for service improvement and outreach. And then Aim 4 is mapping California's Master Plan for Aging initiatives around caregiving to the 2022 National Strategy to support caregivers. Next slide. That does end my presentation. I did want to briefly mention the CASEO survey, as I stated in the very beginning. The CASEO survey is the community assessment survey for older adults. California is one state that recently participated in the CASEO survey that was administered via random participation as well as open participation to older adults age 55 plus throughout the entire state of California. And this survey really allowed us to hear the voices of older adults in the community to find out what their needs are, what their wants are, any concerns that they have as they continue to age. We wrapped up that survey as of September 4th, and we are looking forward to getting the results of that survey. through the Casale survey, we partnered with the vendor POCO, who is doing our data analysis, and we're looking to have the results of that to be published very soon. Again, we are looking forward to all that we learned from the Casale survey to help us to continue advancing the state of California, as well as the services that we are looking to continue to maintain and sustain within the state of California for older adults, caregivers, as well as care recipients. Thank you.
Thank you so much, Nikia and Sarah. So we are just about at the top of the hour, so we have not very much time for Q&A, but I think we'll just wrap up. I'd like to thank all of our speakers today so much for joining us and sharing information, and to thank all of you too for attending this webinar. As a reminder, please fill out the survey at the end of this webinar. We greatly appreciate your feedback. Please also check out our website at nashp.org. There we'll be hosting the recording of the webinar and the slides, and we'll also be sharing more blogs, briefs, and webinars there too. Thank you so much, and have a wonderful day.